Thank you very much, whoever took care of that. We are recording this meeting so that we can post it for other team members to view if they wish. So welcome to this 4th of the year MCH Action Team. We've got that meeting recorded. Please just remember to check your mute button. If you're not talking, you're always welcome to pop off mute and ask a question, make a comment, anything like that. But in between those moments, go ahead and make sure you're muted for the background noise. And also video is welcome. It's also always nice to see at least a couple faces in my little sidebar there. A quick rundown of our agenda. We are going to do our welcome and introductions. We will have our co-chairs introduce themselves to you all. We're going to have an implementation partner spotlight, and then I'm going to describe what we've been doing internally with our data inventory. And then we're going to have a conversation around this action team moving forward into 2024 before we wrap up. And so I'm not actually sure if I have shared this with the team here. It's been in some of our promotional materials, but we do have a vision and a mission for MKE Elevate. Our vision is a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods. And our mission towards that is MKE Elevate supports a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods that are free from oppression by aligning our strategies and building power, partnerships, access to resources, and opportunities for collective advocacy in community-identified priority areas. So it's very descriptive, and it really just lays it all out there, what we are trying to do with this action team and with MKE Elevate as a whole. We shared these shared agreements last meeting, and I just want to make sure to bring them to the front every meeting so we can all remember, kind of center ourselves in how we're in this space. So we're going to remember with our conversations to kind of step up and then step back, take that moment if something feels challenging, respect each other's time and their expertise. We're going to support each other's learning process. So, explain things, assume good faith, explain things, help folks understand the things you understand. We're going to elevate the expertise of lived experience, particularly this topic. That's a really important factor to always consider. We're going to be ready to listen for understanding and for supporting. And we're always going to keep that vision as our North Star, the health of all people and neighborhoods in Milwaukee. See, all my share screens got mixed up. So now for our introductions, we are going to use kind of a newer idea that may be new to most folks in this group. I've seen it in previous positions I've had. It is called the window of tolerance. And so that's what this graphic on the right here. The window of tolerance, it's a concept of your mental presence, your mental state, readiness to receive information or have conversation. It's recognizing that the concept of a window of tolerance can help create more inclusive environments. It helps us foster understanding and empathy with one another. It makes sure that we're aware that our state of mind allows us to approach each other with greater sensitivity, and the self-awareness can help individuals recognize when they are starting to move outside of their window in one direction or another, and understand how our own anxiety and frustrations can affect how we're contributing to a group setting like this. So this yellow box here is the we are in our window kind of zone. So we're in a comfort zone, we're mentally really present, we're engaged, we're ready to participate, feeling calm and collected. If you start moving up, you get into the hyper aroused space. So there might be some anxiety happening, some nervousness, you might be overstimulated in some way. Maybe you're really busy with home projects or work projects, things like that. And on the other side, the hypo aroused, is you're maybe feeling down, things are kind of pulling you into an under aroused state where maybe it's a little hard to stay focused, a little hard to stay grounded. And so it's just recognizing that it is absolutely okay to be in these different states. we just kind of are going to take a little note of that, think about where we are and how that means we're going to be in this group with each other. So you guys are going to go into breakout rooms, but I can at least start. I am both in the hyper and in the hypo, interestingly. I was at a 2-day conference for the past 2 days, so that put me, you know, my prep time was really crunched. I'm feeling a little nervous, a little jittery, ready to get this meeting underway. I'm also starting to come down with a cold, which is really pulling me down into the hypo. So I am managing to be both sides of these spectrums and skipping that comfort zone middle. So that's where I'm at right now. You guys are going to be split into randomized breakout rooms of about 4 or 5 people. You'll have 5 or 10 minutes. Let's see. We'll go with 5 minutes to introduce your name, your organization, where are you in this window of tolerance, and why you joined this MKE Elevate action team. So I think I have to stop sharing for that. How many folks are here? Let's do 9 breakout rooms. My thing will type. Yeah, 4 to 5 participants. And 4:18 on my clock. That'll be about 5 minutes. So name, organization, your window of tolerance, and why you joined this action team. Go ahead and join. So now back to recording. We're gonna now hear from our co-chairs. First, I want to thank everyone who voted for one of our co-chair candidates. I was really excited about all those candidates and really happy with the number of votes that came through. All of the candidates did receive multiple votes. I'm really glad everyone is involved, and I'm looking forward how we can all work together. And so our co-chairs are Akanil Talmsma and Lakita Watts. And I'm going to stop sharing the screen so that they can pop on and introduce themselves a little bit. I know we all already got a brief introduction while we were going through the candidates, but now a reintroduction that they've been selected. So let's see, let's do alphabetical. So Akanil, if you are all right, just that brief little intro.
Sure. Thank you so much for having me here, and thank you so much for those who voted for me or for anybody who was part of this. It's an honor and a pleasure to work with MKE Elevate and to get to meet everyone who's working on this in the community. I'm an associate professor in nursing at UWM, and I'm particularly interested because my research and community interest is in maternal infant health. And we have a number of projects going with that. I see my colleagues are also on the phone, Dr. Gina Holt and Dr. Alex Anderson and Dr. Trina Salm-Ward. So UWM has a great representation here today, and I'm really excited that they're all on board. And we're all working in various research projects with our students to improve maternal infant health outcomes. And we're very much interested in working at the community level to connect with community organizations, community leaders, to make sure everybody has the right information, that women can make the right decision. And we're focusing on empowering the community members. We also work with big data, peri-data. Some of you are familiar with that. And I hope in the future we may be able to share some of the work that's going on there. We're using the peri-data to really get a good population perspective for our projects and for our focused efforts, and work with students on that as well. And then another initiative, Maternity Metrics, is our web app where we pretty much kind of developing the prenatal visit, but take it to the people on an app rather than them coming to the doctor's office, and making sure that the good information, the right information is in the community's hands and can make the right decisions, and as such empowering communities and empowering the pregnant people. So excited to be here, and thank you for letting me introduce myself.
Well, and Lakita Watts.
Hi, everyone. I'm Lakita Watts. I'm the founder and executive director of Essentially Empowered. We are a nonprofit that caters to the community, serving those that experience or witness trauma. And so we have two sectors. One is the mental health sector, working with the kiddos ages 5 and up, supporting them through their anxiety, depression, or anything mental health. And then we have a perinatal health sector where I have a team of doulas that's across the state that have different credentials, whether it's in lactation, mental health, or just overall community health work. And I got involved in MKE Elevate because it aligns with all of my hats that I am doing in the community, and I will just leave it there. Thank you for voting for me.
It's many hats. I've heard her describe all those hats a couple times now. There are many, and I'm very excited to have her on this team. Thank you so much for introducing yourselves, and just to give everyone a little bit of a reminder of those co-chair roles, just a couple ways that they might be involved going forward. Internally, we're gonna schedule some regular co-chair meetings so we can always touch base, share updates with each other, strategize, start planning these meetings together more as a team. So it's not just me, bringing stuff to all of you. Help with meeting facilitation. They might start taking over some coordination of communications to the action team. We're still kind of working out everything that this partnership could look like, but I'm really excited to have some community co-chairs on board now. So we're now going to go to an implementation partner spotlight. We want to highlight all of our maternal child health implementation partners so that we can hear about their organization, learn about the projects they're working on, and start finding ways to connect as action team members. Maybe they describe something and you're like, oh, that'll be great for my thing, and you guys can reach out to each other. Official implementation partners are going to be prioritized, but if anyone is interested in presenting, just reach out and let me know. I will say, I reached out to the implementation partners and very nearly all of you replied, yes, you were interesting. It actually overwhelmed me a little bit. It was the opposite problem I was expecting to have. And so I, this time, went with an internal health department team, mostly because Katie assured me that she was ready to present whenever. But I will absolutely be planning this better so I can highlight some of these external partners, all of you who have signed up and are doing really great work. So we are going to hear today from our Empowering Families of Milwaukee and Direct Assistant to Dad's projects. They are both home visiting, both evidence-based. EFM is working with pregnant people and children for up to 3 years, and that Dad's project is focused on fathers and their children and families. So I will stop sharing so that Katie can take over. Katie, do you see the screen share, or do you need to be a co-host?
I got it. All right. Well, let's see if it works for me to actually do the slideshow. Are you guys seeing the slideshow?
Yep.
Excellent. All right.
Just the slideshow.
Well, welcome everyone. My name is Katie Schlittman. I am the program manager for Empowering Families of Milwaukee, the Direct Assistance for Dads project, and also Fatherhood Healthy Start. And I'm here today to talk to you about 2 of those 3 programs. So Empowering Families of Milwaukee and the Direct Assistance for Dads project. So this is my first MKE Elevate MCH Action Team meeting, and I'm really excited to be here. Some of my team members have been attending since the inception, and I'm hopefully going to be a part of the meetings moving forward, and honored to share my program with you guys today. So Empowering Families of Milwaukee, or what I'm going to start to abbreviate as EFM for short, is a comprehensive long-term home visiting program that serves pregnant and birthing persons and their families. So in order to be eligible for EFM, you need to be pregnant and living in the city of Milwaukee. With that said, we are able to take a small number of postpartum persons every year into our program, but we really prioritize pregnant people in trying to have an impact on birth outcomes. And then the companion program for Empowering Families of Milwaukee is the Direct Assistance for Dads Project, or we shorten it to DAD Project, which is also a comprehensive long-term home visiting program, but instead of focusing on the pregnant birthing person, the focus is on a father. So in order to be eligible for the DAD Project, you need to also be a City of Milwaukee resident, and either be expecting a child or be the primary caregiver or secondary caregiver of a child under the age of 3 years old. One thing that I think is pretty special about the DAD Project is that we are able to serve custodial and non-custodial fathers. And really any person who identifies as a father figure and is taking a primary caregiver role in a child's life could be eligible for our program. So it does not have to be the biological father in terms of relationships that way. So with both of our programs, we are using an evidence-based home visiting model called Parents as Teachers. And that model guides the way that we serve families and also provides us with a curriculum. And the curriculum really looks at parents as a child's first and best teacher. And so really the whole concept is empowering parents to be the ones who are teaching their children everything that they need to know, and really looking at them as the experts in their own children's lives. With both programs, we serve families for a minimum of 2 years, or offer service for a minimum of 2 years. I should say that the programs are free and voluntary, and so families have to want to choose to be in our program and can choose to leave at any time. But we will minimally offer service to an enrolled family for 2 years, and we do not count pregnancy in those 2 years. So if a family enrolls when they're expecting, the clock starts when the child is born. We also do have flexibility to be able to extend a service longer based on family needs. So if we're working with a family and at that 2-year mark, things are just not stable or in a place where we're ready to close, we can extend service when we need to. Most of our visits will usually occur in the family's home. And so that's a really important part of our program, as we want to be working with families in their own environment. With that said, we know that sometimes there are barriers, and so we are able to meet with families in the community when needed. So at times we might be meeting with families at a library or at one of our health centers. We've certainly done visits at Walmart and at McDonald's and things like that. So really whatever is most convenient for the family, we do our best to be flexible and make that work. And then we also offer a variety of different groups and events throughout the year that we would invite our families to. And so some of those are more meant to be support groups, really looking at connecting parents with other parents in a way to support one another. And then we also have family fun events where we have different activities and games and things that we provide. And then we invite all of the children in the family, regardless of the age, to come along and have some fun with us. And really is a very good time. So overall with our goals, one of our primary goals is to promote healthy birth outcomes. So with our intention of trying to enroll as many clients as possible during the prenatal period, we really want to work with families to help have a healthy birth outcome. So have a child born full term and at a healthy birth weight, and then also supporting maternal mortality outcomes. So helping moms and birthing people stay healthy and well during pregnancy and after pregnancy. And so the EFM program is staffed with both public health nurses and public health social workers, which makes the program unique in that families get one of either of those home visitors as their primary home visitor, but then they have access to the other one as a support person. And then the DAD Project also has support to a nurse coordinator when needed to support families with any health issues that might come up. Another one of our overall program goals is to strengthen the parent-child relationship, and that really includes fatherhood involvement. We know that healthy attachment in the early years of a child's life is vital to that child reaching their developmental milestones in all areas. But social emotional development and that early attachment is so important to the rest of their life. And so really looking at supporting families and understanding that relationship and working on that bond and attachment early on, and then throughout the early years of a child's life as well. Another goal is looking at just health and wellness of families. And so that includes things like getting families connected to medical homes, dental homes, mental health providers, vision providers, and then setting goals around their health and well-being that are important to them. With that, of course, our focus is also on the child's health, including safety and development. So once the child is born, we do health screenings on the child periodically, and then can make referrals to primary care providers or other early intervention when needed. We do developmental screening with our kiddos. And so if we're noticing any potential concerns with children not meeting milestones or developmental delays, we're able to make referrals for early intervention and other services as well. The enhanced family functioning goal is probably my favorite. It's the little bit of everything under the sun. And so I think about that as our case management. So we have a care plan that we set goals with families really based on the things that are important to them. So we use a number of screening and assessment tools to get to know families and understand the strengths and their areas of growth, and then work with them to identify the things that they want to work on, and then work with them to get connected to resources and information and support and work towards the goals that are important to them. So it's really a partnership. We are not there doing things for the client necessarily. We're really there to work with them and help them achieve the things that are important to them and really highlight the strengths that they have. With everything that we do, we also are looking at preventing child abuse and neglect. And so by focusing on those parent-child relationships, by talking about child development, by helping parents have realistic expectations for what a child should be doing at any given age, and then helping to address parental mental health and parental stress, we're really looking at overall reducing child abuse and neglect by helping families have healthy discipline strategies and healthy outlets for stress. Also with the parents as teachers model, improving school readiness is something that we are definitely looking at. And so again, looking at that emotional development of a child as a place to get started. And then as they build on those other developmental milestones, really getting them so that when they are entering into the school system, they have all of the social emotional skills as well as the cognitive and developmental and physical skills to be ready to join into academia with their peers and start to learn in a school-based setting and to thrive and do well there. So our visits with families are going to focus on a number of things. So when we're actually in the home, we're going to be talking about parenting and child health and development, family well-being. And so those are all topics that we will visit with families on almost every visit. We will also always come prepared with an activity to really engage the child and parent in play in a way that's working on the milestones that would be appropriate for that child at that point in time in their life. And then again, working with those parents to set goals and get connected to resources. We also have some guiding principles that we think are really important to our program. So one of those is looking at family-centered care. We really see each family as unique and want to get to know their own culture and their beliefs and really honor those things as we work with them as partners. With that, we also know that families are systems and that the needs of all family members are important. And so that even though we have a focused caregiver and a focused child, really we are doing support around every family member in an effort to make sure that the family is as strong and healthy as possible. And of course, that families are deserving of respect and that we see ourselves as guests in their home and really want to make sure that we are entering their space and getting to know them and treating them with the honor and the respect that they deserve to make the choices that they want to make for themselves. We also believe in culturally competent services. And what that means to us is that we are committed to hiring a diverse and representative workforce and really making sure that our home visitors are reflective of the community. And we also know that in our programs, we are serving a very diverse community in Milwaukee. So for example, right now in the Empowering Families of Milwaukee program, over half of our families speak a language other than English and Spanish. And so we really do have very diverse populations. So with that, we have an expectation that all of our home visitors are going to be working cross-culturally and really provide a lot of training and support to make sure that everyone is feeling comfortable and has the skills and humility needed to enter a family's home and honor them and treat them with respect and get to know them. And we also make sure that we have access to interpreters for any family that speaks a language other than English to make sure that communication is also there. So with all of that, we have some videos, and I don't think we have time for all of them, but I'm going to show a video clip of one. And this is a video. The first one is a dad project family, and this is just a wonderful view from the family's eyes about what home visiting is like. And I think it can be really powerful to helping our community partners, as well as potential families that are thinking about enrolling, understand what home visiting looks like. So we'll just play a short clip here.
My name is Joseph. I am 28 years old. Her being born made me really happy. They took her to the table and started cleaning her off. I called out to her by her name, and she opened her eyes and looked right at me. I didn't know how to be a dad, and everything was just happening right then and there.
The name of the program is the Direct Assistant for Dads Project. And what we do is we come into a man's life and we work with him to help him develop the skills that he needs to be a nurturing father instead of just a provider. Most of the programs that you see are designed to help the mother. Not a whole lot of programs are designed to help the father. Sometimes fathers need just as much support as the mother does.
From the time she was born, the resources were there all the way up until now. I wanted to know when, why, how, who do I go see? And he had all the answers for me.
I take the ideas that they already have, and I just add to it. What type of man do you want to be? What type of father do you want to be? What do you want your kids to like about you? And how are you going to do these things?
You just have yourself and your companion. You have your first kid and you become a family. And all the experiences that come with it, from birth up until wherever you let your kid go. Those are going to be experiences that you'll never forget. It really took a lot of those fears away. Leonard is our worker, but he became part of our family. Really great guy, really great program, and because of it, I'm a really great dad.
So there's 2 other videos if you're interested. Home Visit MKE is a great place to get to those. But we don't have time for that today. So check them out. So referring families into our program, if you have potential families that you think might be interested, you can refer them. Families can refer themselves. We have an online interest form. So the QR code is on the screen right now. You can also visit our website and get a link to that online interest form. And you or families can also call in information. Whatever is the easiest way to get families to us, we're happy to take them. I will say that right now, the Empowering Families of Milwaukee program does have a wait list. So if you refer over a pregnant or birthing person, it may be a little while before we actually get them assigned to a home visitor, but we will still contact them right away and talk to them and then triage them into our wait list based on their due date and any kind of known risk factors with prematurity, things like that. So any questions that I can answer on the program?
Katie, there's a question in the chat
Oh, thank you.
from Ahmad.
Let's see.
That was earlier asking about the action team itself. So I believe, yeah,
was
I already answered that one. Unless I'm incorrect, Ahmad, feel free to correct me.
Nope, it was answered. Thank you.
Okay.
And I pulled up that website here on my own computer, and I put that in the chat if anyone would like to open it, just to have it nice and handy. So
Can I just ask, is there an income qualification?
There's not. Nope. All you have to be is a City of Milwaukee resident and either a pregnant birthing person or a father figure who is supporting parenting a child.
Cool. Okay, thank you.
Mm-hmm.
Can I ask real quick too, does it have to be first time pregnancy or any number?
It does not. Any number of pregnancy. And in fact, many of our clients are definitely not on their first child. But first time moms are always fun too. So whatever the situation is, we're happy to welcome them into our program.
Thank you.
And a couple more from the chat. Sorry, my kitten woke up and he wants attention. So if you see that, that's what's going on. Spanish spoken, we do have bilingual for Spanish speakers on that EFM staff, right?
Yeah, we right now have one bilingual staff person. Our goal is usually to have 3 or 4, but we've had some staff turnover and a little bit of a struggle finding bilingual nurses and social workers. So do our best to assign somebody who speaks the language of the client to the client whenever possible. And whenever that's not possible, we use in-person interpretation. And then we'll only default to phone interpretation when we absolutely have to. We believe that in-person interpretation is just much more high quality and that we need the interpretation of nonverbals and all of the other things happening other than just the audio back and forth.
Other questions? Katie, someone did ask for contact info, so if you want to drop your information in the chat, I'm sure more folks would appreciate that. And we also have some kudos from Joshua Liston pointing out that Dad's project. It is dope. They do great work. Shout out to David Comer, who is on this meeting, who leads the Dad's project. Absolutely love seeing love for our projects there. I will
Yes,
say,
I agree. Big shout out to David. He is amazing and is doing great work with our Dad project. Happy you're here today too, David. And I will put my information, David's information, and then the QR code for referrals, as well as it looks like the website's already there. So we'll get you guys all the information that we can. So if you're interested in connecting with us, please do.
I reached out to our EFM project after we did that brainstorming activity in the spring, where folks wrote down either online or on the big post-it notes stuff they wanted to see from the action team. So we had already had on that brainstorm list from all of you evidence-based home visiting, involvement of fathers and partners, culturally respectful and linguistically appropriate care being provided, all of these strategies that we wanted to see that are already being done by our EFM and Dad's program, which is great. When Katie told me that 50% statistic, that is the number of languages other than English and Spanish, I figured it was just going to be 50% speak something other than English, but it's other than English and Spanish. We really do have a diverse population here in Milwaukee, and I'm really glad that they are able to access these services. So, oh gosh, my kitten is falling. I'm sorry. He's so snuggly when he wakes up. I really appreciate you guys being highlighted first. I think you highlight a lot of the things that we want to see spread citywide. Everyone should have these. Everyone should have the resource to make programs like this happen. So thank you very much. I think we
I had a question, if we have time for one more.
Sure.
Katie, is there a relationship with this program and Joshua Liston's Dad Doula program already established?
Actually, it's interesting you ask because there's a relationship that is in the works.
Okay, perfect.
Yeah, thanks.
Love to see that. All right, getting us back to the program here. Hopefully this is where I can save us some time a little bit. I'm going to describe the data inventory that we've been working on. Our data and evaluation team here at the health department came up with a whole plan for us, a 7-phase plan for doing that data gathering that is part of MKE Elevate, so that we can develop either a report card or some dashboards, some format where we can track our progress over the course of this 5-year cycle. So our phase 1 was to look internally and see what metrics the health department tracks that apply to the various MKE Elevate strategies. And then that would show us our gaps. So some of these strategies were obviously put forward by our internal programs who do have data that they can contribute, or we are otherwise monitoring things that are informative to the strategies and objectives. So they did a scan for that first. We are now in phase 2. So I have reached out to implementation partners about those strategies that had gaps. So ones where we were not able to identify a data metric internally, to see, particularly for folks who listed strategies that are already ongoing, if they're collecting any data that can inform that. So, you know, folks, remember, we are not trying to get identifiable information. We're not trying to get anyone's client information. So this is really post-analysis data, kind of at the aggregate level. If folks are already doing annual reports or grant reporting, we're not trying to put a ton of additional work. So finding those metrics that inform the strategies even further. Next up, once we get all that sorted out, we're still working on it. We're going to start kind of defining the roles and responsibilities around data. That's kind of both internally and with implementation partners, and then figure out how frequently we want to collect this data, how we're going to manage it. So kind of the logistical stuff. Then moving forward from there, we're going to start establishing baselines and then targets. And then we're going to work on our communication strategy and providing those updates to the community. So right now we are still very much in the info gathering phase for data. Right now, we did this little table. So this column right here, maternal and child health. We've got kind of 34 strategies listed. Internally, our data and eval team found 5 metrics, but we actually had more than that once I started reaching out to programs. And so between some that were more awareness activities, like tracking some legislation or things like that, that don't really have metrics, that left 24. So we are working on filling in those gaps. And then this bottom part here is level of involvement. And so I wanted to explain that. This is something that we borrowed from the Milwaukee Healthcare Partnership. They do something similar where they categorize strategies that are going on amongst partnership members as lead, participate, or monitor. So for those strategies and objectives that MKE Elevate is leading, that would mean that MKE Elevate is providing staff support or resources. We are the ones on this team establishing and monitoring the work plans and the metrics, the evaluation, stuff like that. So an example from our steering committee is their guaranteed or basic income pilot project. They're doing a lot of groundwork for that. That would be leading strategies. Participating is when other organizations, so like you on this team, are the lead, and then MKE Elevate staff or members serve on a work group, a steering committee, are somehow involved in that. And so the leading organization is the one that establishes and monitors those work plans. And so an example there is Freighter's mobile maternity clinic project. I'm actually on the community advisory committee for that. And then monitoring is at this point the bulk of the strategies that are on the MCH action team. This is where other organizations are leading the effort, and then MKE Elevate folks are participating on kind of an ad hoc basis, or we're just kind of seeing the progress happen, and we're there for information only. So that lead organization is establishing the work plan, they're monitoring it, they're doing the progress, and then sharing it back with us. So an example is our implementation partners working on improving substance misuse referrals, doing, like I shared in that data and evaluation plan, sharing that data back with us. And so right now, the vast majority are on that monitor level, with a handful being on the participation level. Implementation partners largely provided all of those strategies because you were either already working on those things or launching exciting new initiatives. And so you put those up on the brainstorm board. And MKE Elevate is included on the progress for those projects. The only one I wanted to give this update that is currently in the lead category was, if anyone remembers that strategy, that was develop a blueprint for closing racial disparities in birth outcomes. That was put on there by MHD leadership for this project for MKE Elevate to really push it forward. And we're working out still what that plan is going to look like, both internally, externally, who's going to kind of lead it, where the involvement is going to be. So keep your eyes out for more on that. Any questions there about the data inventory? And then once the implementation partners, once you all have shared your data, we've got a whole big spreadsheet. We're going to take a look and see if there are any further gaps. And if there are, I might be reaching out to all the rest of you, sharing those strategies and seeing if any of the rest of you happen to collect any of that data. So that may be still coming your way down the line. So now we are going to start talking about moving forward, going into the next year. So we internally have been kind of working on a 90-day plan. We focused on reaching out to those implementation partners, following up with folks, getting that data and evaluation inventory, and then kind of starting some background research, seeing what things we could take more of a lead on. But there's still plenty to discuss. This is the broader MKE Elevate, so beyond just this action team 90-day plan. Here are some things that folks are doing. We're always working on one-on-ones with folks, with both the action teams, all three of them, and the steering committee. If any of you want to learn more, especially folks who may have joined more recently, always reach out to me. I am more than happy to set up a 30 or 60-minute meeting and get you all caught up, explain things, see how you can be more involved if you would like. We are creating that plan for releasing the CHIP report. We're going to host a launch party for that report. And, again, working on more meetings, and in particular, a Spanish focus group, because we got some feedback that the first translation we had was maybe not totally the highest quality it could be. So that's kind of through the end of the year. And now we want to start looking towards 2024. So we've got this list of strategies and objectives. Don't worry, I'm going to be sharing those out in the follow-up email so you can review them. And some of the other co-hosts have them accessible. So when we do a breakout session, if you need to refer to them, we should be able to share. We want to look at what we should prioritize in the next year, in 2024. So remember, this is a 5-year cycle, and we're kind of coming up on 1 year into it. So what should we prioritize in the next year? That will lead other things for the second half of the cycle. This is just a list of ideas. We could think about narrative development, whether that be around the action team, MKE Elevate, maternal child health more generally in Milwaukee. If there's a story we want to tell there, we could focus on growing the team members and the implementation partners. I know that this team is not comprehensive. I know there are more folks out there in Milwaukee doing this work, so we could definitely focus on that. We could focus on cross-promoting each other, working with each other, finding ways to do that. We've also tossed around the idea of technical support. So like if folks need help with grant writing or coming up with ideas for that, developing our communication strategies. These are just some ideas that we brainstormed. It could look like anything for going forward in 2024. So we are going to be in breakout rooms. This is going to be by the objective, by the goal topic. So we're going to have, I've got a Google Doc so that folks can take notes collectively in those groups. We're going to, again, talk about what the action team should prioritize next year, and then how should we work on those priorities? Should it be dedicated work groups? Is it part of the action team that we do in these meetings, or are they going to function independently, take on their own kind of management? That's all open for discussion. And then also, this is the call for folks. Is anyone willing to lead one of those priority efforts? And then at the end, we're going to have a very quick report out for each group. So now those breakout rooms are going to be by topic: healthy birth outcomes, reproductive health care quality and access, maternal mental health. So I know especially those first two are really similar. Healthy birth outcomes are kind of those system levels things to work on facilitating healthy pregnancies, healthy families, stuff like that. And that reproductive health care access is the quality the, culturally respectful aspects, the comprehensiveness of the reproductive health care, that sort of thing. And then the mental health one is maternal mental health, infant mental health, families, all of that. So you will be choosing the group that your work is most aligned with so that you can have a more focused discussion in each breakout room. So now, let's see. I'm going to stop sharing the screen because I think that'll be easier for me to set up the breakout rooms. I already made some breakout rooms. It's trying to default me back to the other one. Our introduction ones, but that's not the kind that I want. If any of my other co-hosts are skilled at the breakout rooms, feel free to hop in and let me know.
Sure. Do you want people to be assigned randomly, or how do you want to do that?
The select breakout room, the one where they can choose.
Melissa, I can do it up pretty quickly. I got it. I just have to rename the breakout room so folks know which one they're getting into.
Yeah, it's trying to default me to what we did for the introductions, which is totally different than what we're trying to do now.
So do we know?
It
So now
should
we
be
have,
open. It should be open up the 3 breakout rooms.
Yeah.
And
So it should have popped up on your screen. Scroll all the way down to the bottom, and you should see a join button by the 3 topics.
Yeah. I think it's working. Looks like it.
Yep, people are moving on over.
I don't see what you're talking about when you say scroll all the way
I'm not
down.
seeing it either. Oh, for me, I'm on my mobile phone. Now I see it, like a little window popped up. I see.
Looks like many of them are already in breakout rooms.
Yep, a lot of folks are still here though. Kong, would you be willing to stay out of a breakout room and kind of watch this space and help folks get into the breakout room they want?
Yeah, that's fine.
Thank you very much, because I will be joining a breakout room this time.
Okay, I'll be hopping over.
Yeah, I don't know. I want to join a breakout room.
I think Kong should be able to assign you to one.
Yeah.
So just let them know which topic.
Yeah, Dr. Greer, we have healthy birth outcomes, reproductive health care.
The birth outcomes.
Okay.
The healthy birth outcomes.
I'll assign you that one.
Okay, thank you.
Can you put me in the healthy birth outcomes also? I didn't have anything pop up for me.
Anyone else?
Yeah, this is Melissa. I didn't have anything either. Can you put me in the reproductive one?
Okay.
Thank you.
Thanks, Kong. I'm going to go hop into a breakout room myself.
Yeah, sounds good. Yep.
Keeping us moving. There's the recording back. We'll do some very quick report outs. I can do that for the healthy birth outcomes unless someone wants to jump off mute and do it for me. So we discussed quickly what the relationship between this group and another group I'm working to launch could look like, and I got some very helpful feedback on that. And then we were talking about for 2024, making sure that Black Birth Symposium event continues to get prioritized and promoted. There's just too much good energy around it to, not prioritize it. The cross-promoting and partnering suggestion was really appreciated. Folks liked hearing from the EFM Dad program, and so hearing from more partners, it gets those juices flowing. How can I partner with them? Or maybe I know somebody else who should be connected with them. That's the way we get these connections happening and getting out of our silos and starting to bring resources together. And then we also had the idea of a media campaign, whether that's promoting those videos like we saw. Any other folks who have kind of storytelling videos like that would be great. Social media, things like that. And then there was a comment right at the end that this is for everyone. If you are interested in being an implementation partner but are unsure or you have questions or anything, please always reach out to me. I know it's kind of a confusing thing. You might need to talk it through a little bit. I'm always happy to talk through that with all of you. So that was just a really general one right at the end there. If anyone would like to give the big highlights from Reproductive Healthcare Group.
I'd be happy to summarize. We had a great discussion and always too short, of course, but to highlight a number of items, we talked about syphilis testing, and could we have a mandate or recommendation that all pregnant people are evaluated for STDs so that nobody slips by. And we were wondering, perhaps you could advise us what would be the strategy to have this become an issue that we pursue and take to the leadership in the right way to make it happen. So that's one action item. The support for the birthing person. And that was very clear, is there from doulas and family and all that, but the support for the person that supports the birthing person. And that is a major issue. How can we educate and support those supporters and help them navigate the healthcare system and be an advocate for them? And what can we do or should we do to have them also feel and supported and being able to support adequately? And that's an area that we would like to work on. The reimbursement or better reimbursement of those supporters, as well as Medicaid, of course, would be a wonderful thing. And I think that sums up the highlights. And please, anybody jump in if I missed something.
Yeah, just the Medicaid reimbursement for doulas and for the postpartum, like getting that to 12 months.
Yeah.
Those are two of those ones that don't necessarily have metrics because we're just watching to see how they progress. So someone from the maternal mental health group.
I can report out since I have the notes, and then those of you that were in the group, feel free to hop in if I leave anything out. We started off with talking about what's currently happening between our organizations around maternal mental health. So I think it'd be great to kind of, in our follow-up email, include those organizations that's doing specific things to maternal mental health, to support maternal mental health, because there were a lot of good programs and screenings that is happening in our in the city of Milwaukee. But for priorities, we talked about assessments and screenings. We talked about how we think that hospital systems, or we want to look into hospital systems and their follow-up of the Edinburgh assessments. We talked about technical support with screenings and what that could look like as a follow-up. How do you go from screenings to direct referral services? Being able to recommend a screening tool that is appropriate to use for specific populations. Training for maternal health workers specific to trauma-informed care and addictions and morbidities, as well as the Edinburgh assessments. We also talked about an asset map to understand all of the different programs and efforts in Milwaukee. And then when it comes to the priorities, to include the voices of those with lived and living experiences and ensure that they are compensated for their time.
There is a lot of great ideas in there. That is awesome. We are very close to the end. We're going to run up on our time as always. I'm just getting us back to the presentation. So just to wrap up, again, those implementation partners, if anything we've talked about is particularly in line with your work, or again, in my follow-up email, I'm going to send out our list of objectives and strategies. If you see anything that's like, we do that, we are always happy. Implementation partners is open on a rolling basis, so you can always submit that. I have the link here somewhere, so that if you're interested in just pulling it up right now, you can do that. If I lost the chat though. It'll also be in the follow-up email itself. That was not it. Oh my gosh. My copy and paste is being very funny today. I'm just going to keep it going. Our future meetings, notice this one is all Zoom instead of being hybrid like it has in the past. And that is because we're just focusing on these winter meetings. We don't want to worry about inclement weather. Some of you may have remembered when I got snowed out last February. So ones where weather like that could happen, we're going to do all Zoom. And then we're going to focus on those spring and summer meetings being hybrid. Those future meetings are still up in the air. They could include more networking time, coordinated work around those shared objectives, especially after the conversations that happened today. If anyone is interested or has ideas for policy presentations, technical assistance trainings, more partner presentations, always open to more suggestions. So please bring those forward. Thank you, Annika, for sharing those links in the chat. She put the implementation partner link, and then she also shared our upcoming launch meeting. Again, this is just more, share me those suggestions, get on the list for sharing your partner organization. Our CHIP report launch party, that's the registration link that Annika put in that chat. That is going to be that full MKE Elevate report, and that is going to be on Thursday, December 14th at No Studios. That is in the Pabst Brewery neighborhood. And then again, that implementation partner link is, you'll be able to select which action team. Thank you for the clarification, Teresina. So it's the same link for everyone, and then you'll be able to select which action team and which goal you're working on. So it's all the same one. Joshua, let me know, connect them. I certainly don't have all the organizations on this team right now. Always looking for more connections, more ways we can keep boosting each other. This is an ongoing process with this whole cycle. So keep sending me, do an email introduction, or you can just email me. Hey, you should reach out to someone at this organization I know about, anything like that. We want to keep growing. We want to keep finding the people. Like you said, the smaller organizations can be hard to hear about, even if they're doing great work. We want to promote those people. So refer them to me. You can share my contact information with anyone you think is doing work like that, so that we can get connected and get involved. And so there will be a evaluation sent in the follow-up. There should be, Teresina, on that implementation partner link, you should be able to, there's space to list multiple things. So it's a pretty comprehensive implementation partner agreement. You should be able to list all the things you're working on. And so again, that's for anyone. And if you need to talk about it first, reach out. If you have events, opportunities, trainings, if your organization is hosting something, whether it's one-off or if it's regularly recurring, either way, if you want it promoted to this group, please send it to me. In those many emails that I send out to everyone, I'm going to start attaching a document of all of the recurring things, so that I don't have to take up so much space in the body of the email with those things that are always going on. So if you've got a weekly peer group, a monthly education hour, whatever it might be, I can still promote that and am happy to do so. So any final questions or comments? Again, all the information from today, I will be getting that into a follow-up email so that you'll be able to refer to it and continue providing, contributing to that conversation. And if there are no further comments, thank you very much. Again, myself, Akneil Talmsma, and Lakita Watts are your co-chairs. It says I'm screen sharing, but it's not really showing me what I'm screen sharing, so I might just go ahead and stop that. Reshare if anyone would like to see our contact info. Those are our 3 email addresses for the co-chairs. You can reach out to us. Comments, questions, concerns, connections. I'm out of C words, so I'm going to stop there. Thank you so much, everyone. I'll stop sharing so we can see each other.